Hello, everybody, and welcome to the Tuesday edition of Video Clips, which is brought to you by Wellness Forum Health and the Wellness Forum Institute for Health Studies. Just a couple of announcements, and then I'll get right to today's health news. First of all, we're shipping holiday cookies, and they're so delicious. Chocolate, no artificial sweeteners, no animal foods, vegan chocolate cookies. We ship them any place in the United States, $24.95, including shipping per dozen. So this is the time to order. We can get stuff to the intended destination in time for the holiday. Free tours of Wellness Forum's websites with a free Q&A with me that follows. I'm doing this on a regular basis. We'll be offering several more at the first of the year. And we have an upcoming campaign that I'll tell you a little bit more about at the first of the year, which is a Refer a Friend program that will allow you to accumulate some points towards some of our fabulous courses and some of our more expensive memberships. So watch for news about that. And then this week is the last healthcare, or next week, I think, is the last healthcare workshop for healthcare professionals who are wanting to know our thoughts about an independent healthcare system and things that they need to do, that you need to do if you're a healthcare professional to get ready to participate in such a system. And we've spent a lot of time on this. We've been working on it actually since 2014 is when we started, 2013 or 14 is when we started really giving serious consideration to this. So we are going to do something about this in the coming year. And if you are in the healthcare business and want to be part of that, you need to start engaging with us now because we're going to give priority to both educated consumers and educated providers who are ready to join. Okay. So, speaking of a new healthcare system, today's message kind of goes to the point of why we have to do things differently if we're going to survive in an independent healthcare system. According to the American College of Rheumatology, about 790,000 total knee replacements and over 450,000 hip replacements are performed every year just in the United States. This number is expected to increase because of our aging population. The ACR states that total joint replacement is one of the safest and most reliable treatments in medicine, but the question is, how many of these replacements are really, really necessary? Maybe not as many as you think. According to a presentation delivered at the annual meeting of the Radiological Society of North America, muscle strength in the leg is a major factor in determining if a knee replacement will be necessary. Two muscle groups, the quadriceps and the hamstrings, act as counterforces that facilitate a wide range of motion while protecting the knee joint. Exercises that strengthen these muscles and maintain the balance between them can prevent the progression of osteoarthritis that results in the need for knee replacement in over 50% of patients. The cost of a knee replacement in the United States ranges from $30,000 to $50,000. And the procedure is a major revenue source for orthopedic practices and medical institutions. Diet change, exercise, and weight loss are low cost and better interventions, but of course you can see that there's not much economic incentive to recommend these. Instead, the diagnosis of osteoarthritis is usually the beginning of monitoring the progression of the condition until joint replacement is the only option. In addition to economic considerations, there are many reasons to work at diet and lifestyle change to prevent the need for a knee replacement. A study including 100 older patients who were eligible for knee replacement surgery showed that over a 2-year period of time, all of them got better, including those who were only given non-surgical treatments such as exercise, dietary advice, and pain medication. While the patients who had the surgery, the knee replacement, did better initially, they had 4 times as many complications like infections, blood clots, or knee stiffness that was severe enough that another surgery requiring anesthesia was required. Complications are more serious than many people realize. 1 in every 100 to 200 patients who has a knee replacement dies within 90 days of the procedure. And what that tells me is that a lot of people who are very precarious and who are in very terrible physical shape are having these knee replacements. And so you want to start taking care of yourself now so that you don't require all this medical intervention as you age. As many as 1/3 of those who undergo a knee replacement surgery continue to experience pain in spite of the fact that the knee has been replaced. Now, to be clear, there are situations in which knee replacement is the right thing to do, and sometimes only viable option. But in many cases, other options are both safer and better. There are many causes of knee pain. I mean, being overweight or obese and is probably the most common, and lifestyle change that leads to weight loss not only relieves knee pain, but addresses many other health issues as well. In some cases, the knee is not tracking properly due to muscle imbalances or injuries and that sort of thing. And if this is the case, one of the problems with the replacement knee is that it may not help because the new knee will also not track properly. So strategies such as yoga and physical therapy with a competent PT are the best option in these cases to fix that tracking problem. So just an FYI, I'm going to teach another virtual yoga series starting in the first Sunday in February next year. I only do 10 students at a time in these classes because there's a private session involved, so I can really work on alignment issues with the students. So you might be interested in taking that series. And then another option, many of you may not know that Wellness Forum membership includes all Wellness Forum memberships of any level include opportunities to spend in a group setting time every month with our behavior coach, our physical therapist in this case, and also our psychologist. And you can bring up these kinds of things for discussion. So another reason to be a member of Wellness Forum. So if you are interested in information about the upcoming yoga series, or you're interested in membership information, join one of my free tours or send me an email at pampopper@msn.com. But, there's so much of what we do in medicine is just not necessary. It's expensive, but it's not necessary. And to the point that I was talking about earlier about an independent healthcare system, healthcare systems all over the country are subsidized by state and federal governments, and an independent system won't be. So unless you eliminate this type of waste, it can't survive. So you have to have educated consumers, educated health professionals to converge in a system that will prevent the overuse and over expense associated with this type of thing. All right, that's it for today. As usual, if you pass this on to anybody who you think might enjoy watching it or learning from me, and I will be back to you tomorrow with more news.